Osteoarthritis, one primarily seen as an ailment of the elderly, is now emerging as a widespread health issue across age groups in India. Sedentary lifestyles, rising obesity, hormonal changes in women, and a rapidly aging population are accelerating the burden of this degenerative joint issue. To understand the key drivers behind this trend and explore effective ways to manage and prevent osteoarthritis, including the growing role of nutraceuticals, we spoke with Dr. Sudhir Joshi, a leading orthopedic surgeon associated with SL Raheja Hospital, Samarth Orthopaedic Centre, and Breach Candy Hospital in Mumbai. Thank you so much, Dr. Joshi, for joining us. So, I would like to
Thank you.
start this conversation by understanding the evolving landscape. In the recent years, osteoarthritis has become a growing health concern in India. What factors, according to you, are contributing to its increasing prevalence across different age groups?
We will divide this prevalence of osteoarthritis into simple categories. The young arthritics, which deserves the maximum discussion, are from the ages of 20 to 40. These group of patients find themselves becoming arthritic due to their lifestyle, such as excessive athletic activity in some patients. And in most patients, it also means sedentary lifestyles, working on a desk, computer, and leading a very sedentary work pattern. Also, deficiencies of D3, inflammatory joint diseases, and nutritional deficiencies all contribute to arthritis in younger age group. In the elderly, which begins somewhere around the age of 40 to the age of 65, the main causes are obesity, diabetes, D3 deficiency, heredity, which is a major factor, and alignment problems such as bowing of the legs or knock-knee deformity, which is more predominant in the Anglo-Saxon population. We have predominantly a deformity known as bow legs, which affects the Indian and the Oriental population. The elderly, the octogenarian age group, of course, have continuous prevalence of osteoarthritis, which is maximum actually statistically, and in them the main causes being chronic wear and tear of the joints. Weight-bearing joints are chronically worn out in the really old people. So this is the main causative factor or distribution of factors around the age groups, various age.
So, if you could highlight how India's aging population is contributing to the increase in osteoarthritis cases?
It is estimated that India will have a population of about 140 million aging population in the near future, around 2030 or so. And to deal with this ailment is extremely taxing on the health resources, health department's resources, and also leads to tremendous suffering for each individual. So we have to take really very active steps in prevention as well as in management of these arthritics, who are going to outnumber our health facilities in a short time.
Okay, so we often hear that women are more prone to joint pain, especially after a certain age. Could you explain why that is so?
You see, women develop menopausal syndrome where there is a short spell where the estrogen levels drastically drop. Estrogen is responsible for maintaining the health of the articular cartilage. Therefore, women naturally suffer from a tendency towards osteoarthritis around the age of menopause or 8 years nearly after the onset of menopause. Second factor, strong factor in women is obesity. Obesity is a major factor in causing osteoarthritis in the female population. Third thing is they are inattentive to their nutrition, leading to deficiencies of various types. Thyroid deficiencies also contribute to female osteoarthritic incidence. So these are the various factors.
And do you think nutraceuticals contribute to bone and joint health, especially in managing osteoarthritis?
There is a growing body of evidence which is in favor of the nutraceuticals making a very important impact in the management of osteoarthritis.
Mm.
The undenatured type 2 collagen is known to alter the immune responses and stimulate the Peyer's patches in the intestine to generate enzymes, to curtail the generation of enzymes in inflamed joints, such as the interleukins and the TNF alpha. These enzymes lead to more cartilage destruction and pain. So when a patient receives this undenatured collagen, type 2 collagen, the Peyer's patches are stimulated to curtail these enzymes in the joints. And this leads to subsidence of symptoms as well as improving health of the articular cartilage.
The next question is, what is your clinical experience with nutraceuticals like UC2, glucosamine and chondroitin, and collagen peptides in improving joint function?
I have collected a certain body of evidence which is suggestive that these medicines do give an increased response of pain relief. Their requirement for NSAIDs or the infamous anti-inflammatory drugs is definitely markedly reduced if you administer the nutraceuticals to suffering population. Secondly, there have been some studies wherein definite improvement in the range of movement of joints when treated with undenatured type 2 collagen have been demonstrated. And MRI changes to go with these studies also are very encouraging in the sense they really show a definite objective improvement in the MRI picture.
Okay. So, with elderly population more prone to joint degeneration and fractures, how important is it to introduce nutraceuticals early as a preventive measure?
There is no definite evidence in our literature. Although, looking at the pharmaceutical properties of these drugs, it is a very attractive option to administer these medicines as a preventive measure.
Okay.
It may be that the onslaught of osteoarthritis, like we previously mentioned, of 140 million patients facing the health services, may be brought down by early administration of nutraceuticals in these cases. This is a hopeful sort of thinking, wishful thinking.
Okay.
At present, there is no evidence to support this.
And in your opinion, how can awareness around nutraceutical-based joint care be improved among patients?
Problem with arthritic patients is they keep on bombarding themselves with painkillers and anti-inflammatory medicines. And they don't pay attention to regular daily routine of exercise as well as fitness programs, then keeping their D3 levels in check. Also, they are unaware of the nutraceuticals and the value in the management of osteoarthritis. If we can make them aware, the awareness about these drugs increases, then the necessary evil of having to take painkillers and nutraceuticals mitigate the requirement for NSAIDs, reducing the toxicity and maintaining health standards.
Okay, so how important is everyday movement like walking and stretching in managing joint pain, especially in the older adults?
Extremely important to maintain a level of activity, because just as osteoarthritis is a rapidly progressive disease, it is also it has also a simultaneously uh, occurring regenerative phenomena with it. And this regenerative phenomena requires supplements with nutraceuticals, as well as maintaining a full range of movement and flexibility of the joints, which is achieved by regular walking and exercises, and also taking these medicines. So we have to have the regenerative part of the osteoarthritic process.
So you did mention about pain reliefs. My question is a little. My question needs asks a little more on people who actually rely on pain relief for joint problems. So how does staying active helps in managing long-term stiffness and mobility? If you could address that.
Administration of nutraceuticals has been demonstrated to have range of motion improvement amounting to about 5 to 7 degrees over a treatment period of 3 months. So that is certainly encouraging, because uh, they have no toxicity, and purely depending on painkillers or steroids or intraarticular injections is not a good option at all. All of these have their toxicity, whilst nutraceuticals have hardly any toxicity. There is no toxicity. If you ask me, the glucosamines and chondroitin sulfate is not as good, because glucosamines raise the glucose levels and also cause fluid retention. So you have to be very careful in administering glucosamines to pre-diabetic patients. Whilst this is not the story with type 2 undenatured collagen, which is very safe.
Okay. So, coming to the last question, what types of low impact exercises do you usually recommend to patients dealing with osteoarthritis or age related joint issues?
High impact exercises leading to one time peak load rise on the joint is the most decisive risk factor which has been identified, such as jumping from a height. And you see, athletes who undertake routinely such sport which involves landing on the feet with a thumb, these are definitely causative factors in osteoarthritis. Therefore, if a patient is going to follow a regular exercise schedule, he must follow low impact exercises. Commonly, the advice given is that if a spot jogging exercise has been advised, or running is advised as a cardiovascular fitness exercise, then the tips of the toes, which are lifted up from the ground, should not rise above the level of the ankle joint of the contralateral leg. So this is called low impact running, and this the athlete must follow. Second good low impact exercise is walking in a shallow pool of water. That is called hydrotherapy, and it is extremely useful for prevention and treatment of arthritis of the hips and knees. Whereas running on a treadmill or walking briskly on a treadmill is definitely a high impact exercise. It causes severe ground reaction force and damages the knee cartilage.
Thank you, Dr. Joshi, as you emphasized that addressing osteoarthritis requires a shift from reactive pain management to more proactive and a holistic approach, one that combines movement, proper posture, and evidence based nutraceutical support. With India's aging population on the rise and younger adults increasingly affected by joint issues, Now is the time to build awareness and promote preventive joint care. I really want to thank Dr. Joshi for taking out time for this important interview. Thank you so much, sir.
Thank you very much.